Well, good morning. I'm Sean Edwards. I'm a specialist paramedic from the ambulance service, as discussed.
And I'm Sue Morris, researcher at Kent Fire Rescue.
And we're part of West Kent Emergency Services roundtable, which aims to improve dementia care in West Kent for emergency services. Unfortunately, Liz Champion from Mason Referrals NHS Trust, Patrick Griffiths from Kent Police, and Rachel Spencer from Kent Fire Rescue couldn't be here, so we're presenting on their behalf as well. And this forms the whole roundtable group. And so we were set up in 2018 with the sole purpose of improving dementia care for those people living with dementia who come into contact with emergency services, be it police, fire, ambulance, or the hospital trust. We wanted to improve the knowledge of those who work within the service and knowledge of those services available to them in order to reduce hospital admissions and improve that patient journey or non-patient journey if they're not medically unwell. Within that encounter. Sole purpose of this is to reduce hospital admissions and improve that collaborative working within West Kent. In May 2019, we hosted a dementia conference. We had 110 people from all walks of emergency services, search and rescue, community teams, and people living with dementia attending and learning more about what services were on offer in West Kent. So what do we want to achieve this time? So we want to upscale this conference from just West Kent to the whole of Kent. We want to make a much bigger impact than we did. We want to make it available to the whole of Kent and surrounding areas. We'll be invited holding a bigger conference with a whole Kent feel. So all these referral pathways that are available in West Kent and the East Kent and Swale, North Kent, inviting all those partners to share what they do and get those people who are attending the conference on board and hopefully using those referral pathways to keep these people out of hospital. We really want to engage using the emergency services, community teams, hospital staff, charities, community groups, anyone who has any contact with people living with dementia to know what's available. And we want to spread learning as well. So what we took from last year's event was we found that people learned a lot. People had a limited knowledge of dementia, and actually people did learn lots from these speakers we had. Particularly around holistic management, it's not just medical management. We're talking about social prescribing, what's available in the community, and the available referral pathways, not just medical but charity-based as well. So why is this a solution? From the last year, May's event this year, we had fantastic feedback, which Sue's going to talk about in a minute. That event was a great opportunity for networking to find out what others did and how the police interacted with the ambulance service interacted with the fire service, search and rescue, community wardens, and charity partners. Shared learning, chance to ask questions and offer their own experiences. Also, we hope to have a large audience. As I said, we had 110 attendees back in May. We're looking to upscale this to around 500, hopefully more, if we can get whole Kent involvement. And we're going to have a wide variety of speakers and interactive stands, get some workshops going, get people really engaged in that dementia care.
So, in terms of evaluation and sustainability, how we measure whether the event has been a success or not, Sean mentioned that one of the things we were aiming to do was try and reduce the numbers of people going to A&E. But obviously there are lots of different factors involved with that, so we can't really use that as a measure. So we were more interested in what people learned, whether they felt more confident, whether they knew all the different pathways that were open to them, and ultimately what people will do differently as a result of the conference. So what did we learn from last year's event? We found out that people really enjoyed the event. They found it really useful. They did grow in confidence and knew about all the different pathways open to them. But we also found out that people wanted representations from more widely different areas of Kent, not just West Kent. So it was on that basis that we wanted to build a wider conference for next year. And they also wanted to hear from lots of different partners. So again, not restricted only to West Kent. We also found out that people wanted a bit more interaction in the presentations, and that actually people from different organisations, different emergency services, found different.
Up, so less like a few words.
And so we can incorporate that into next year's conference, and it can be long-lasting by taking away the presentations and spreading it amongst their colleagues as well. Thank you.
Thank you.